The medical profession is full of buzzwords and catchphrases. One of those is navigating the healthcare system. You know what it means, but it's a bit of a mouthful. I prefer to rephrase that in simple human terms. What is standing between you and the care you need? For the purpose of this brief introductory video, we'll just do a quick overview of some of those obstacles. In subsequent videos, we'll dig into how you can work around and get through those obstacles. It's about making a healthcare system that doesn't always work as it should work better for you. A lack of insurance coverage or inadequate coverage remains the biggest obstacle to care for many. The Affordable Care Act cut the number of uninsured Americans significantly. Still, 30 million Americans are without insurance. Many more, 43% of U.S. adults, have inadequate coverage. These groups are far more likely to avoid or delay needed care. In life terms, this can mean not filling a prescription, skipping a recommended test or treatment, or follow-up visit, or having a medical problem and simply not going to a doctor or clinic at all. Specific medical conditions carry their own challenges and obstacles. In addition to being a licensed board-certified radiologist, I'm also a board-certified obesity and medicine specialist. I am keenly aware of how obesity can be connected with a range of other health problems, including high blood pressure, type 2 diabetes, gallbladder disease, osteoarthritis, metabolic syndrome, just to name a few. A condition like this can require multiple interventions and multiple specialists. It can all get very confusing and overwhelming. Future videos will be devoted to such challenging health conditions and to breaking down how you can identify and overcome the obstacles to getting the care you need. It must be said that sometimes the biggest obstacle to getting the care you need is, well, you. I don't say that to shame or to judge. Medical issues can be scary. The workings of the human body are mysterious and out of view. It is natural to delay dealing with something we are anxious about, and I see it all the time in my practice. As a radiologist, I'm often involved in the initial diagnosis of medical problems. And as an interventional radiologist, I can also be involved in the early treatment of something like a tumor or unwanted growth. Patients are urged to schedule necessary tests or procedures soon after the diagnosis, but they don't always do it. I have seen patients delay treatment only to find a tumor has rapidly advanced in the meantime. Sometimes the decision to avoid or delay care stems from mistrust in the medical profession, and sometimes this mistrust exists for a good reason. The new documentary, executive produced by Oprah Winfrey, The Color of Care, opens with a heartbreaking story of a Black man who was refused a COVID test 3 separate times. Not once, not twice, but 3 separate times. Despite exhibiting many of the classic symptoms, and despite having recently checked his own father into a hospital for COVID, he eventually gets COVID himself and tells his son, "I'm done with hospitals. I'm tired of being turned away. In essence, I'm tired of being invisible to the healthcare system." The Color of Care shines a light on racial disparities in healthcare that have existed for decades, but become even more obvious during the pandemic. As a result, African Americans, Latinos, and Native Americans fell to COVID or were hospitalized in greater numbers than the rest of the population. The pandemic illustrated a shocking fact that public health advocates have known for a while. The greatest predictor of your lifespan is not your DNA, but your zip code. We live in 2 Americas, served by 2 healthcare systems. Distrust and unconscious bias in the medical profession are very real obstacles to care we will cover in depth in future videos. In my own practice, I am passionately committed to building trust and a sense of human connection with my patients. I believe healing happens best when there is a partnership between patients and the provider. In that spirit, I hope this series of videos can shed some light on how the healthcare system works and how it sometimes doesn't work as it should. And I hope you can use that information to take control of your health and well-being and to take the steps you can to ensure you get the care you need.